What I've learned really most recently over the last 4 or 5 years is that we parents are more the perpetuators of stigma than our children are. In particular, I'm going to pick on us dads. Us dads, again, have been falsely taught that silence is strength. We're protectors and providers, but we need to listen to our children. If a child works up enough strength or nerve to come to a parent and say, I'm not feeling myself emotionally, whether it's I'm depressed, I'm dealing with anxiety, I've got all this pressure on me to perform at school, or whatever the case may be, or even if they come to you and say, I'm having suicidal thoughts, we can't turn them away. We can't say you'll be okay. We can't say you're exaggerating. We'll deal with it tomorrow. We have to listen. Dads, to me, have to take a leadership role because what I've learned is many people tell me, I've never heard a man talk about this the way you do, passionately. Many of us men suffer needlessly in silence, and not only would we be improving our own quality of life, but again, we will be demonstrating to our children and to our spouses and to the community as a whole that we're human too, and that it's okay to talk about this. And I think that's really important. Our children are looking for that. My favorite program that's available to schools is a NAMI program called Ending the Silence. And Ending the Silence has 3 adaptations, I guess I call it. One is an anti-stigma program for students. It fits within a typical 45 to 50 minute class period. And we bring an adult like myself as a facilitator and a young person, because young people like to hear from young people. We bring a young person in recovery and just have a very open conversation about it. And it has proven to be tremendously successful. The next is there's Ending the Silence for teaching professionals. And when we say teaching professionals, we're not just talking about teachers, counselors, administrators. We're talking about the bus drivers, the lunch lady, the custodians, because we have to understand that when our kids are in school, they spend more time in school than they do at home. And they engage, and many of these children build relationships with school staff. And so the lunch lady or the custodian may see changes in your child's behavior that you don't even recognize. So that program it allows us to help those professionals identify children that might be experiencing behavioral health crisis, and then connect them and their families to local resources. And then the last adaptation is really for parents, PTA, PTO. We can come in and do a presentation for those organizations, because we need, again, 1, to break the stigma, but 2, to educate parents on some warning signs, but also on the resources that are available to them as well. So that's my favorite. There's NAMI on campus that is on college campuses, but we're also pilot testing, having that in schools too. And that really just creates a community for young people who might be experiencing behavioral health crisis, to have relationships with other people who are experiencing the same thing.